like to welcome Samantha Brown-Parks, who is with Health and Human Services. She is the Regional Director for the Atlanta region, and she is going to open us up today. So please join me in welcoming her to the stage.
Good morning, and thank you for the kind words, and thank you to the State of Reform team for bringing us all together today. It's a privilege to be here with the people who are truly the boots on the ground, from physicians to hospital leaders to care management teams to the state leaders from underneath the gold zones. These are the rooms where true progress happens, because this is where patients meet policy. I come here today not just as the Regional Director of the U.S. Department of Health and Human Services, but as a family medicine physician from a rural community in Florida. And I've spent my whole career teaching med students, training residents, and taking care of patients in the full spectrum of life. Together in this room, we can see what works, and we, more importantly, can see what doesn't work, so that we can share our best practices. We can build a comprehensive system that truly addresses health needs. At HHS, our number one priority is focused on a clear and practical vision, making Americans healthy. But health doesn't start at the hospital door. It starts by getting back to fundamentals of better nutrition, a smarter use of resources with data-driven accountability, and strengthening our workforce while aligning our incentives to actually support prevention and long-term health. Here in Georgia, that mission feels especially urgent. Because of Georgia's strong state leadership, it stands out as one of the best states to do business. Georgia continues to grow with a thriving economy, and that attracts new families and businesses every single day. However, that growth brings extra pressures on hospitals, pressures on providers, and a general access to care issue. Our healthcare supply can simply not meet the increasing demands. And this isn't new to rural communities, but the challenges are intensifying as we develop more and more. Through a $50 billion investment by CMS earlier this year for the Rural Health Transformation Program, there are now real resources on the table to help us rethink how healthcare should be delivered. The Georgia State Office of Rural Health under the Department of Community Health is strategically planning how to best use the $219 million that have been allocated to Georgia for this year. They're not just looking to stabilize health systems, but they're looking to modernize them through technology, improved data sharing, accountability measures, and most importantly, through people. We need people to fuel the change. In order to have more physicians and nurses, you need to train more physicians and nurses. Doctors tend to practice where they train. This is one of the most consistent predictors of workforce. If we train them here, they tend to stay here. If they leave, they usually don't come back. As someone who's trained residents for years, it's not just about filling the slots. It's about creating relationships, creating communities, and giving those early career physicians a reason to put down roots and stay where they are in Georgia. So when we talk about expanding GME positions, particularly in primary care and rural health tracks, it's not just a workforce discussion, it's truly an economic strategy. Hospitals that invest in GME have measurable returns by improving patient access, increasing service line stability, so you know what's there, and long-term economic benefits to the community through increased jobs. Because I hope that, and I know that we're not in here just for money, we're in here to make a difference, to make a change. I want you to consider this beyond the numbers. It's something more fundamental. It means that a patient in rural Georgia has a doctor who knows their name, that goes to the same grocery store, that lives in their community. It means that fewer hours are spent in cars traveling just to get basic health needs met. And it means that we create healthier communities that can sustain the growth that we're all here for. That's a win for patients, that's a win for hospitals, and that's a win for the state of Georgia. And at the same time, we're aligning this work with other basic priorities that support health in a comprehensive sense. With $4.4 trillion spent annually to treat chronic disease, it's bankrupting the American healthcare system, and poor nutrition is at the center of the crisis. 1 million Americans die annually from food-related chronic illness. So HHS is putting a renewed emphasis on nutrition because the truth is, we can't afford to treat our way out of chronic disease. And it starts with something really simple, eating real food. The movement to remove ultra-processed food and increasing locally produced food is being encouraged at all of our institutions, from schools to prisons and even hospitals. Hospitals have a unique opportunity to be the leader in changing how Americans view the food that they put in their bodies. And when hospitals produce locally sourced meat, when they procure locally sourced meats and produce, it's not only providing nutrient-rich foods that are needed for the most vulnerable populations, but it's decreasing waste, it's decreasing transit cost, and it lifts up the American farmers. HHS is focused on being good stewards of our taxpayer dollars. We are actively eliminating fraud, waste, and abuse so that the valuable resources can go to where they're actually needed, to patient care, to workforce development, and to community health. But none of this works in isolation. The federal government can set priorities and provide support, but the real innovation happens here at the state and local levels and within your healthcare systems. So today, as you're sharing your experiences with your colleagues in the breakout rooms, I want you to take a hard look of where and how you can grow, and not just growing, recouping dollars and value-based plans, but how you can add long-term value for your patients, for your institutions, and for the community at large. So thank you for everything that you do every day for Georgia Health, and have a wonderful day.